are talking about the patient who is having heart attack or acute myocardial infarction, it comes to our mind that the patient should get the appropriate treatment immediately. But what can be that treatment? It can be angioplasty when the patient gets a stenting done, or it can be a bypass grafting. But which one to choose? So that is a dilemma. And to talk about us, we have Dr. Nirmal Jain, who is interventional cardiologist from Manisha Universal Hospital, Mumbai. I welcome you, Dr. Jain.
Thank you. Thank you so much.
So, before going into the details, which one to choose, first understand what exactly is cardiac stenting and bypass grafting. Dr. Jain, please throw some light on this.
Yeah. Thank you, Dr. Seetal, for kind introduction. And we know once a patient is diagnosed as a heart attack or any heart condition, like it can be chronic stable angina, where patient develops only angina, no heart attack, or sometimes patient is having major heart attack. We call it as acute myocardial infarction or non-ST elevation MI. After going for an angiogram or angiography, depending on the angiography picture, patient will require either medical management or angioplasty or bypass surgery. Now, which patient require which treatment option? It is always individualized approach, but there are broad guidelines are there over which we can decide which patient will require angioplasty or bypass. If patient is having a single block is there, which can be 70% to 99% or 100%, and which is not involving the left main artery or any other artery, then angioplasty is a better option. If patient is having two or multiple blockages are there and involves left main artery or proximal part of the left anterior descending artery, or diabetes is associated with this condition, then bypass is used to consider a better option. There are various gray zones are there where both options are there. Then depends on patient's profile, hemodynamic conditions, patient's blood pressure, patient's other disease condition like kidney disease, diabetes, patient's physical condition, and the age of patient is also an important criteria to differentiate whether patient will require an angioplasty or bypass surgery. Look at the in the past, like 10 to 15 years back, bypass used to be considered for all patient who is having multiple blockages or more than two blockages. But in recent years, because of the advancement in the cardiology and advancement in the stents, like we have second and third generation stents are there, advancement in various delivery techniques in the angioplasty, good antiplatelet drugs available with significant reduction in the LDL cholesterol. These all lead to a significant improvement in angioplasty outcome. So nowadays, many patients whom we used to do bypass 10, 15 years back are able to do angioplasty in these era. Dr. Sheetal, you're muted.
Sorry. Thank you. Uh, it's very important that we understand which patient needs angioplasty and which patient needs a bypass grafting. But usually, Dr. Chen, what happens? Patient does not take one opinion. Patient goes to two, three different doctors, and then they take opinion, and then they say that this doctor said bypass grafting. You are saying angioplasty. But in such scenario, what should the patient do?
Yeah, definitely. Because criteria for angioplasty and criteria for bypass are well defined, but many a time patient's angiography picture or many a time patient's clinical profile, they are in gray zone. A patient can either opt for an angioplasty or bypass surgery. But I think it is a cardiologist's decision that is matters most, and we have to see which uh, procedure, whether it is an angioplasty or bypass, will last longer, which will be a safer option for these patients, and which have a long-term good outcome. That is the best way we should tell our patients. Now look at the picture, like a patient is having acute myocardial infarction or acute heart attack, and he is undergoing an angiography. On angiography, we see multiple blockages, but one artery is having 100% block that is responsible for the heart attack. Then this patient will require angioplasty of that 100% artery, and the other artery can be taken care later after 2 to 3 weeks or 5 to 7 days after a patient is stabilized. Second scenario is where patient is stable, no heart attack is there, patient has underwent an angiography because of chronic stable angina symptoms, and he is having multiple blockages. One is 100%, other one is 90%, and other one is 70%. Then this patient will have a bypass as a first option, angioplasty as a second option. So definitely, clinical scenario is very important. Which patient will require angioplasty and which patient will require bypass?
That's very important. Apart from the patient, like doctor, patient also need to understand all these things, and they need to be explained that these are the scenario and why we are choosing the stenting or bypass grafting. That's very important. But sir, when we are talking about this, even if we like counsel the patient which one is better, still does the patient has the liberty to choose what they want to go ahead with?
Yeah, definitely. If you see any layman, they have an assumption that if you go for a bypass, that will last for a long duration. If you do an angioplasty, it will last for a few years, and then again the stent will to be replaced, or stent will have a reblockages. But I just want to make it clear that nowadays, because of the advancement in cardiology, the results of angioplasty is as good as bypass surgery. We have to choose patient wisely, which patient require which procedure, first thing. Second thing, it is always a cardiologist duty to explain all pros and cons of both the procedure, which procedure is safer, which procedure is good for that patient, and then only patient should be taken for any procedure. Now look at the scenarios like those patient who takes multiple opinions with the angiography CD, and one cardiologist will say angioplasty, one cardiac surgeon will say bypass surgery, and other will say medical management. This is very common scenario nowadays in our country. But what I see is uh, we have to see whether these blockages are heart life-threatening. Second, if these blockages are associated with a highly calcific coronary arteries, if these blockages are very long, if these diseases are diffuse disease, if these diseases are associated with diabetes and kidney disease, then definitely these patients will require a bypass surgery as compared to angioplasty. But if patient is having 4 or 5 blockages also, but these blockages are very short length blockages, good size arteries, not a diffuse artery, not a bifurcating lesions are there, then we can go ahead with the angioplasty also with 3 or 4 stents. So definitely, clinical scenario is important. Angiography picture is very important in deciding whether patient will undergo angioplasty or bypass. Now, you see data about the stenting. If you have a good outcome after angioplasty, a good size stent is placed, a good quality stent is placed, and the result is good, and if patient is following all the lifestyle modifications along with the antiplatelet drug or hypolipidemic statins are he's taking regularly, then long-term outcome of stents are very good. And we have seen because of advent of newer generation antiplatelet drugs, the stent thrombosis rate has almost gone down, and even the restenosis rate is quite low, provided patients taking care of his or her lifestyle.
That's very important from the patient's perspective to understand what would be the outcome of the procedure which they have undergone. But sir, when we are talking about outcome, that is one thing, but risk which is associated with it. So how do you compare the risk which is associated with cardiac stenting compared to bypass?
So we all know angioplasty is almost a non-invasive approach where a patient will be good to go home after a day or two of the procedure. He can resume all his duties within a week, and patient there is no cut is there, no wound infection, no stitch, and nothing will be there, and patient is mobile very fast. The risk involved with the angioplasty is definitely patient can have a local site hematoma from where the angioplasty is done from hand or groin. Patient can have a heart attack during procedure. Patient can have a stent thrombosis where the clot can develop in initial phase of stenting, or patient can have long-term re-blockages in the artery. We call it as a restenosis. So these are the common complications which can occur, but if you have a good result post angioplasty, then these complications are very rare. You can say less than 1%. Regarding bypass surgery, we all know it is a invasive surgery where the either a midline cut is there or there is a side cut is there to do a bypass surgery. Patient can have a wound infection, which is common if patient is diabetes and diabetes is uncontrolled. Few patients can have atrial fibrillation where the heart rate goes high and irregular, and few less than 1% risk can have of stroke risk, which is common in elderly patient, or highly calcific aorta is there, or calcific subclavian artery is there. So these are common risk involved with bypass surgery.
Thank you. When we are talking about these two strategies to treat the patient, does age matters?
Absolutely. Age is also a confounding factor whether we have to go for angioplasty or bypass surgery. So, age and physical fitness is very important for bypass surgery. If patient is physically cachexic, low underweight is there, and he is very weak, then he may not sustain bypass surgery. Then angioplasty is a good option for that. And for angioplasty, also age is an important criteria because in advanced age, what we see is highly calcific coronary arteries are there. Then it is difficult to negotiate these arteries. Then we may require rotablation or IVL therapy to negate these calcium spurs and then put a stent. So outcome can be compromised. So any elderly patient is a high risk patient from bypass as well as angioplasty point of view. But I think angioplasty is a slightly safer option as compared to bypass in elderly patient. Though in my practice, we have done a bypass of 94-year elderly also. He was physically fit. Three blockages were there. They were highly calcific. We gave both options of angioplasty versus bypass. He was because he was physically fit, mobile. He underwent bypass, and everything is fine. It's almost 3 years now, and he's doing well.
Thank you, Dr. Jain. Age is one factor while deciding what should be done for the patient. But when we are talking about the other comorbidities, like the patient may have, as you earlier mentioned, the patient may have diabetes, the patient may have chronic kidney disease or peripheral artery disease. So even these conditions also needs to be taken care, right, doctor?
Absolutely. Diabetes is a very common accompaniment or risk factor for coronary artery disease. And in our country, where we are diabetic capital in the world, and almost half of coronary artery disease patients are having associated diabetes. And we know diabetes patients have a diffuse coronary artery disease, multiple blockages are there, small vessel is there, and where outcome of angioplasty and even the bypass is compromised. But it is even in the guidelines, it is said that patient is having diabetes with multiple blockages. Bypass has slightly better outcome as compared to angioplasty. But because of the advent of newer generation stents and the good antiplatelet and the statins, nowadays angioplasty has almost similar outcome as compared to bypass. But diabetes along with left main coronary artery block, or diabetes along with LMCA with proximal LAD block, I think bypass is better as compared to angioplasty. Regarding kidney disease, the important thing we have to understand that in kidney disease, any procedure is very high risk procedure, whether patient is going for bypass or angioplasty. In angioplasty, because of dye overload, patient may require temporary dialysis. If there is a renal shutdown or acute kidney injury is there, then patient may require dialysis. So many times, if create is on a higher side, like 1.8 or 2 is there, then we take all precautions so that patient will not require any kidney replacement therapy or dialysis post procedure, where we try to use minimum dye in angioplasty. We can dilute and dye with the normal saline and use, and we can give various other drugs to decrease kidney injury. So kidney patients usually have a high blood pressure along with associated diabetes, and multiple blockages are there. Calcific blockages are very common in kidney diseases. These patients are at high risk of kidney failure, even of post bypass, because of the hemodynamic changes during bypass, where BP can go down during procedure, and it can lead to acute renal shutdown where patient may require dialysis. So these patients are at high risk, and we have to choose individualized approach whether patient will require an angioplasty or bypass, depending on patient's angiographic picture and associated comorbidity and physical condition.
Thank you, Dr. Jain. This is very important to understand the comorbid condition which is associated with the heart attack. So apart from this, you said that cardiac stenting, the patient can recover within 7 days. Bypass may take longer than that. But when the patient is like after the procedure, what kind of precautions the patient should take?
Yeah, definitely. If patient is undergoing an angioplasty, the most important thing is if patient is the indication was chronic stable angina, patient can resume his or her duties within a week, and he can do all his or her activity depending on left ventricular ejection fraction or heart function. The most important thing they have to take care is definitely diet, exercise, that is lifestyle modification. But the most important thing is antiplatelet drug, because once you put a stent, even it is a drug-eluting stents are there, it requires at least 8 weeks to internalize these stent to the arteries. So up to that time, there is a high chances of stent thrombosis there. So we require antiplatelet drug or blood thinners to so that we can prevent stent thrombosis. That's why whenever I do any angioplasty, I make sure that patient will never stop any antiplatelet drug before consulting any cardiologist. So antiplatelet drugs are very important. Statins are very important for to decrease cholesterol. And even if cholesterol is normal, they should never stop any anti-lipid drug or statins. And if any other risk factor is there, like blood pressure, diabetes, they should continue these medication along with lifestyle modification. So definitely, we should always emphasize, it is not just doing a stenting and then ask patient to do whatever you want to do. They have to take care, because these diseases are lifestyle disease. Once a heart disease, lifelong is a heart disease. And they, because if they will not take care, there is a high chances that patient will come back with other blockages or re-blockages or re-stenosis in the stent. Regarding bypass surgery, patient will be there in the hospital for 5 to 7 days post-procedure. They have to take care for their wound for at least 2 to 3 weeks till the stitches and everything is removed. They have to wear a belt for at least 2 to 3 months so that there is no gapping is there and patient's sternum is totally healed. And apart from that, all the other precautions, what we have discussed in angioplasty, like antiplatelet drugs, statins, control of other risk factors, they have to take care. So these diseases, even after procedures, they have to take all medications, control of risk factors, lifestyle modification, they are very important.
Thank you, Dr. Jain. So, when we are talking about these procedures, stenting and bypass, these are two different procedures and treated by two different specialists. Though it's cardiologist, but internally the specialties are different. So, would you like to throw some light on that?
Yeah, definitely. Interventional cardiologist, like I am interventional cardiologist, we do angiography and angioplasty. If patient is requiring bypass surgery, then it will be done by a cardiac surgeon. Though you can say the heart team approach is always there, where we involve interventional cardiologist along with CVTS surgeon or cardiac surgeon and anesthetist. This we call it as a heart team approach, where we take a decision. In many a time, it is a difficult decision to take whether patient will require angioplasty or bypass. Then it is a combined decision of a cardiac surgeon and interventional cardiologist whether patient will require an angioplasty or bypass surgery.
Thank you, sir. That's a very important information that it's not one specialist who is taking a decision, but it's a team approach who decide what is better for the patient.
Absolutely.
I think that's it. I have that those many questions. If you would like to highlight any important message for our audience.
So I just want to make one quick comment that there is always a misconception that angioplasty is inferior to bypass surgery. If you have multiple blockages, go for bypass only, not for angioplasty. If you have a one block, then go for angioplasty, not for bypass surgery. So this is not a scenario. It is person to person. We have to take a decision. Nowadays, in one patient, I have put 7 stent also, and even with one blockages, I have advised a bypass surgery also. So depending on the angiographic picture, depending on various other comorbidities, it is the decision has to be taken. And if It is really long stents are required, multiple stent with overlapping stents are required, and the left main artery and bifurcation stentings are required. Then I think bypass is a slightly better option than angioplasty. Then, regarding bypass surgery, it is always if arterial graft, if you put in bypass both the arterial graft you put, then long term data is good. But if surgeon is putting venous graft from leg, then outcome is not good. Many venous graft they close within a year or 2 years. In recent past, I've seen few patients they have underwent bypass surgery just 2 years back. Now they are again having symptoms. When we check with the angiography, the grafts are closed. So it is always discuss with surgeon which graft he's putting, where he's putting, what will be the long-term outcome. That is very important. Even in the angioplasty, which stent we are using, how long the stent length will be there, what are the long-term data is there. I think we should discuss with the patient and then only we should go ahead with these procedures.
Thank you, Dr. Jain. This is very important that patient needs to be aware, not patient, but the family member who are accompanying the patient, they also needs to be aware what exactly is being done with the patient, what is the procedure, and what are the risks which are associated, and definitely then take the decision. But please leave the decision to the experts because they know the patient better. They discuss among themselves. So that is a better option for you to give your patient in an expert's hand.
Yeah,
Thank you,
absolutely.
Dr. Chen.
Thank you. Thank you so much, Srit.
Thank you so much, audience, for joining here. Thank you so much, everyone. Bye bye.